This is an extremely terrifying and frightening moment for the people of Africa. It's important to note that that report that was released by the World Food Programme was already saying to the world that in 2020, we were already facing a major food crisis. That was before the coronavirus hit. Now we're looking at a situation where the report says that we could be looking at about 300,000 deaths per day over a 3-month period. Now, the reality for Africa is that before even the coronavirus hits, this is what we are dealing with. We're dealing with healthcare systems that are not strong. We're dealing with a population that has high levels of vulnerability because of the high levels of HIV, AIDS, and tuberculosis, and malaria. And we're looking at economies that are actually really struggling. So right now, I think we are in a very vulnerable state as the African continent, and we hope that international solidarity will be there to help our people get through this very bumpy ride ahead of us. I think that the positive news is that the extent of how fast the virus has moved through the African continent has not been as devastating as it was in Europe. So when we look at the situation in South Africa, for example, the interventions that have been made by the South African government have really been to actually ensure, in the first instance, that we prevent deaths, but to actually buy time for when the pandemic peaks, so that during this time we ramp up on PPE, we ramp up on testing, field hospitals, and so on. So that's what's being planned. Right now, as we stand, the level of loss of human life in the African continent compared to Europe or the US, for example, is still painful, but you know, like South Africa, for example, the number is still under 100 deaths. So the preparedness, though, the preparedness of African countries, if we have a situation like what we had in New York, in terms of ventilators, equipment, trained personnel, and so on, is going to be pretty devastating. So that's why I think, you know, the efforts now that are being made by individual African countries, but also by the African Union, needs to be generously supported. Because for many people in Africa right now, the choice is almost also between, if you want a pandemic that's a health pandemic or a hunger pandemic. And as many people are saying, you know, if we don't get killed by COVID-19, we'll get killed by hunger. And so balancing this is going to be a very tricky act of leadership. But what we hope is that we have a mentality in terms of how we think we need to build the continent forward, is not to build back exactly what we had, which shows all these vulnerabilities. We have to learn from this so that we are building in a way that we address the climate crisis, we address inequality, we address maldistribution of budgetary resources, and so on.